Welcome, everyone. Thank you for joining us. We've reached our start time. All participants have been muted. If you have any comments or questions, please use the chat box today. This meeting is being recorded, and the recording will go out after the meeting. Check out the attachment pod for the slides from today's meeting. This presentation was made possible by the Preschool Development Grant Birth through 5 initiative from the Office of Child Care, the Administration for Children and Families, U.S. Department of Health and Human Services. We're excited to have our experts on today to talk about data privacy. And without further ado, I'm going to pass this over to Jim Lesko to get us started.
Thank you, Evelyn. Happy to have this opportunity to introduce our next in a series of webinars being supported by PDG B-5 on data integration. And today's webinar will be focused on data privacy. And presenters will be Ross Lemke, Sean Cottrell, both of whom are with AEM Corporation. And we'll also be fortunate to have Whitney Phyllis and Stephen Matherly, both from Utah, who will give us some state-level experience and some opportunity to hear how they process through the data privacy elements within their state. Today's community of conversation is an invited opportunity for our PDG grantees, plus their partners and their consultants as a part of this conversation. The PDG B-5 TA team are also on the line today, as are most likely some federal project officers and some of the regional office specialists, and as are finally our partners with the State Capacity Building Center. We always like to make sure that we say that these conversations are voluntary in nature, and we're glad that you're here. This is an open discussion. The presenters have asked if you would please use the chat box to pose your questions. So you'll see that on your screen, and there'll be lots of opportunities to respond to your questions, both directly from the presenters and hopefully from some of the state representatives that'll be on the call. And our privacy conversation will look at overview of privacy laws relevant to the preschool development grant, state experiences with privacy challenges in the use of early childhood data, participant questions, and we'll have some closing slides and comments. So I'm going to turn this over to Ross and Sean, sorry. I'm not quite sure who's going to take it on next.
Perfect. This is Sean, and I'll go ahead and give us a quick introduction. So myself and Ross Lemke. Ross Lemke is the current director of the Privacy Technical Assistance Center at the U.S. Department of Education, where we focus on supporting districts and states with the administration of the Family Educational Rights and Privacy Act, also known as FERPA, which will be the topic of discussion today. My name is Sean Cottrell. I'm a senior subject matter expert with PTAC at the U.S. Department of Ed. I joined the team at PTAC in January of 2018, where I was formerly the privacy officer for the state of Wisconsin. But more importantly, I also served in a capacity as interagency data governance coordinator for Wisconsin's Early Childhood Integrated Data System, working between the Departments of Children and Families, Department of Health Services, and Department of Education in combining their data to create an Early Childhood Integrated Data System. During today's webinar, we would really encourage you guys to ask any questions that might be jumping into your head throughout the presentation. We will be devoting time towards the end of today's webinar to answer as many questions as we can. And even if you don't have any questions, maybe there's something that you're struggling with and you're just gonna, looking for some feedback or anything like that, please don't hold back, and we'd be more than happy to, work with you outside of this webinar, if you do have any more lengthy type questions. So please don't hesitate. So without further ado, we'll go ahead and dive in. Looking at privacy in a nutshell, over 100 countries have privacy or data protection authorities, and those models fall into three distinct sort of shapes. First is a very comprehensive approach, very prescriptive, saying what you can and can't do and telling you really how to do it. There's also a self-regulatory approach where it's very hands-off, where industries regulate themselves. They create the standards and they create the metrics to manage those models of privacy. And then we have the sectoral approach, which is what's applied in the United States. And you can think of the sectoral approach to privacy when you think about health privacy with HIPAA, or education privacy with FERPA. We also have additional federal privacy laws that we'll be talking about today. Some of those additional privacy laws, other than FERPA, are the Individuals with Disabilities in Education Act, Part B and Part C, which both apply to children with special needs or disabilities in the early childhood sector. We'll briefly touch on HIPAA, the Health Insurance Portability and Accountability Act. We'll talk a little bit about Head Start program performance standards and state and local laws. Without further ado, I would like to introduce Whitney Phyllis, who is the current Chief Privacy Officer for the Utah State Board of Education, and Steve Matherly from the Utah Department of Health to share a little bit about some of their struggles and some of the pain points that they've experienced, but also an opportunity for them to talk about some of the successes. So Whitney and Steve, I'll go ahead and turn it over to you guys.
Hi, thanks so much. Yes, like was mentioned, my name is Whitney Phyllis, the Chief Privacy Officer for the Utah State Board of Education, and many of you might be working in SEAs, state education agencies, but some of you might not be. Just to give you a little background, many states SEAs do not actually have a dedicated person for student data privacy. Utah's unique in that regard, and so you won't always have someone at your disposal, but what I think Steve and I want to provide for you are lessons learned so that you don't have to struggle as much as others. And Utah has a unique early childhood data system, just like every other state. Things are set up differently, so some of the things that we might talk about aren't going to directly apply. But for example, our Utah Department of Health includes home visiting, Title V, Part C, Medicaid program, where the Utah State Board of Education, which is the state education agency, we have funding through the SLDS grant, Part B, Title I, and then we have another organization, Division of Workforce Services, that actually has taken over our SLDS database, and they work with Medicaid eligibility, child care subsidy, TANF, SNAP, and Steve knows much more about these things. But I think one of the biggest takeaways is that it's extremely important for the cross-agency leadership, the data stewards, and the stakeholders to have an understanding of the legal requirements for their program, the privacy requirements for their program, and also security. And working with those tech vendors is important as well. And I think I don't know if Steve is able to speak yet, but what he can speak to, I think, is more granular level, is that there are a few existing documents that we've relied on heavily that will help solve a lot of your problems. So Steve, what more do you have to say?
Steve, you probably need to hit *6 because we can't hear you.
We'll give Steve a minute. I know he's on the call and listening. We're chatting, so he's going to be able to speak to this. So while Steve can interrupt me when he gets back on, but I think some of the lessons learned that Steve kind of has spoken to me about was to look at the political landscape and the political will, because this will certainly affect your success and sustainability. They'll be asking questions of, will one agency facilitate or lead the early childhood integrated data process? Who will make those decisions? What kind of data governance structure do you have there? Where will the data be centralized? Who will have access to it? I know with our system, there were a lot of growing pains because of staff turnover in different agencies. It seems like I think Steve can speak to that.
Hello, hello.
Oh, hi, we can hear you.
Oh, wow. Say, sorry, everybody. I thought I'd be able to connect just through my computer audio, but had to call in instead. Thanks for your patience. Yes, Whitney's got it right. We call our early childhood integrated data system eKids, and so you'll hear me refer to it as an eKids. And every eKids is unique throughout the nation. And so just first of all, as she said, our eKids is at the Utah Department of Health. We've been working on it for 7 or 8 years now, so it doesn't happen very fast. And that was mainly because we were not a race to the top early learning challenge state. Instead, we've made sure but steady progress using blended funds from our Early Childhood Comprehensive Systems Grant and through funds from our partners that facilitate the Child Care Development Block Grant over at DWS. And additionally, another thing that took us a while is we had to build our matcher system. And we wanted to build a matcher system that would benefit the entire department and not just for our eKids. And so those are very important considerations. Right away, a lesson learned is if you're considering establishing an eKids, will you be able to tie into your state's SLDS matcher database, or perhaps another agency has one, or will you be developing your own? And then, Whitney touched on how we're very unique in Utah, so I think if we can pull it off, that many states should be able to, or we're loading the data right now, or reports are coming live right now. And I mean, so our eKids at the Department of Health, our SLDS grant is at the Utah State Board of Education, which passes through over to our Workforce Services Agency to fund and administer the database. Programs that we have at Department of Health are home visiting and WIC and Part C and Medicaid and child care licensing. But we're reaching out to additional partners. You can think of it this way. Our eKids, our role is to bring in the non-Utah State Board of Education pre-K data. So whatever doesn't fall under their umbrella, well, that's our job to bring it in. So we're working with our Head Start partners. We're working with our child care assistance partners, as well as Help Me Grow and others. And then the Utah State Board of Education Well, they have the state pre-K data. Well, we're not universal pre-K yet in Utah, but we have many grants for high-quality pre-K services. And we have, obviously, we have Part B and, Title I. And so we rely, now we will send our data. 2017, the state passed legislation which created this Utah Data Research Center. And they do that with state and SLDS funds. So we will send our data to the Utah Data Research Center, and that's already in place, but I'm speaking specifically to our e-kids. And the Utah State Board of Education will also send their pre-K data as well as kindergarten assessment data, DIBELS, language literacy, things of that nature to the Utah Data Research Center. And then together, we will be able to establish a distinct count of children served, by which programs, which order, how about the frequency, the dosage, and then we can really build from just having some kind of basic quantitative type of analytics, and we can really get into impact and outcome research. And then, as kind of been mentioned already, it's extremely, lessons learned, extremely important to have supportive cross-agency leadership at the very top. You must have EDO support. And then down, your data stewards have to be involved, your technology department, whether that's internal or external, all stakeholders that you intend that will contribute data to your system need to be involved in the beginning and throughout, especially as you co-create your data sharing agreement and your data governance manual. That was a lesson well learned for us. We were dragging for a while. We were having a hard time getting our head starts on board, and that's because they had a very valid point. The voting structure we had set up wasn't very equitable for the independently owned and kind of operated Head Start grantees. So we worked hand in hand, developed a very comprehensive data governance manual that everybody felt that was equitable, as well as a streamlined data sharing agreement. And once we had those things in place, it really led to swift progress. Some other things, kind of a laundry list of lessons learned. Like I mentioned, EDO support. What about political will, political leadership? As soon as we've had this legislation that created the Utah Data Research Center. We also have legislation that speaks to a early childhood governor's commission or cabinet, and these things really lend to making progress with regard to data integration. You'll need to kind of decide: are you going to have a lead agency host this database, and or multiple agencies, or is it going to be a not-for-profit, someone that can kind of facilitate? Might not have necessarily a lot of data or any data in the game, but they could serve as a hub, or is it going to be one of your state agencies that takes the lead? And then a lot of states, what they've constructed is a early childhood a board, an office of early childhood, where you have underneath one roof, you've got your Part B, your Part C, your pre-K, Head Start, Child Care, Title I, etc. If it's under one roof, lucky you, that's going to help things move forward. But let us be an example that it doesn't have to be that way if you keep the lines of communication open, as well as work with PTAC and others to establish, effective and legal data sharing agreement. And then, other considerations is what kind of system are you going to set up, whether that be centralized or federated or a hybrid. I'm going to stop there because I know that that's the presentation for next week. Another thing importantly to consider, will this be a research database only, or will it have operational capacities such as triage of referrals and case management aspects? Or will your e-kids be purely for research purposes? And then, as I mentioned earlier, are you going to be able to tie into a extraction, transfer, and load kind of match your database, or will you need to start from scratch and build your own. Keep in mind you're going to need money for ongoing maintenance and to enhancements for additional data elements and such, and for your ongoing sustainability. I'm talking kind of quick, so I know I took a minute to get on the phone. So just lastly, and then we'll let the questions fly, as I mentioned, co-create your data sharing agreements with your partners, as well as your governance manual. Develop and distribute both at the same time. And here's the trick. You've got to create documents that are foundational and processes that are foundational and firm enough to facilitate your objectives, yet they need to be flexible enough when there's changes in political will or leadership or legislation, things of that nature. And it's very, very important to document all your decisions and agreements along the way, because believe me, you're going to see turnover, and you don't want to work very hard through certain processes, come up with agreements and understandings, and then have a little bit of turnover, and then have to do all that over again. Speaking from everything that I'm saying has been lessons hard learned. Get with your technology people up front. Make sure that you're setting it up with your segmented server network and isolated databases and things of that nature, so that you're FERPA, compliant. And lastly, and then we'll take any questions. I wish two things. I wish that I had the slide deck that the presenters at AEM have put together today. It's very wonderful to see all the FERPA stuff and other things such as HIPAA in one place. Here a few years ago, when I came on board to work on this, I had to look everywhere for all these different documents, kind of piece them together and learn from it. And the slide deck that you're going to receive as a part of this webinar is just invaluable. And it also has the citations and sources, which is wonderful. And then I would encourage anybody who's working on an SLDS or an eKids, if they want some wonderful knowledge as well as a few good laughs, to read an unofficial guide to the why and how of state early childhood data systems, Answer Prevention Fund by Elliot Regenstein. If I said his name right, I hope. But anyway, that was so good for me to read when I was in the middle of all this, and it's written in a way that's very informative and a little bit of tongue-in-cheek and entertaining. So it's good stuff. So let me, Whitney and I threw all that out you. Now let me back off a little bit and make sure we're okay on time and questions and things of that nature.
And hey, Steve and Whitney, thank you guys very much for providing that insight into the experience in Utah. I think we're going to hold questions towards the end of the webinar. I'm just looking at time right now. So kind of diving right into FERPA. If we look at FERPA from an 80,000-foot view, we can really sum it up in these three key bullet points. FERPA generally gives parents and eligible students the right to access and seek to amend their children's education records. It protects the personally identifiable information from education records from unauthorized disclosure, and additionally, it imposes requirements for written consent before sharing personally identifiable information unless an exception applies. So what is this concept of PII, which is what FERPA protects? Well, PII embodies direct identifiers such as a student's name, their social security number, maybe a student ID number. It's that one-to-one or direct relationship with the student, but it also embodies indirect identifiers such as a student's birth date or other demographic information, primarily when we're looking at aggregate reporting for groups of small populations or populations with sensitive characteristics. We might inadvertently be able to identify the single white male student in the class of 5 or the black female student in the small class of 5, which is why sometimes we talk about disclosure avoidance. So what are education records? Under FERPA, education... Sorry about that, got a little thrown up. Education records under FERPA are directly related to a student and maintained by or on behalf of an educational agency or institution. So the definition of an education record is very broad. What rights do parents and eligible children have? Well, they have the right to inspect and review education records. They have the right to request amendment of education records, the right to consent to disclosures with certain exceptions, and the right to file a complaint with the U.S. Department of Education regarding an alleged violation of FERPA. If you are using consent, which again is the general rule, we recommend that it usually be baked into the registration process, and consent under FERPA is fairly prescriptive. FERPA says consent must specify the records that will be disclosed, the purpose for the disclosure, and identify the party or the class of parties to whom that disclosure will be made. Additionally, consent should be signed and dated, but does not have to be in ink, pen ink. It can be done electronically as long as the identity of the parent, in your cases, especially in early childhood, as long as that parent's identity is appropriately authenticated. There are 16 exceptions to consent under FERPA. So if you do not have parental consent to disclose early childhood education records, generally there is an exception that will make sure that you can still continue the work that you are doing. School officials have access to education records when appropriate compliance pieces are met. Schools for where a student seeks or intends to enroll. And then there are additional study exception and an audit and evaluation exception. And we're going to dive into some of those in the next few slides. Legitimate research under FERPA. FERPA doesn't really speak to research. It talks about studies and it talks about audit and evaluation. Research and evaluation under FERPA can happen legitimately one of two ways. Again, either with consent of the parent or the eligible student. An eligible student would be for any of you guys running programs that have Doogie Housers in them. There might be some young children who are enrolled in college. FERPA says that once you turn 18 or enroll in college, the FERPA rights transfer from the parent to the student. I would recommend, if you are in one of those situations, that you reach out to PTAC for some additional guidance. The studies exception. The studies exception under FERPA is fairly straightforward. The studies exception requires that if you do not have parental consent, you can only provide data to develop, validate, or administer a predictive test, to administer a student aid program, or to improve instruction. Generally, studies that we see fall under the improve instruction bucket there. And again, if you are using the studies exception to disclose PII, it's very important that you articulate how that particular activity is for the goal of improving instruction. Under the audit and evaluation exception, again, very similar. However, that activity must be to audit or evaluate a federal or state-supported education program or to enforce or comply with federal legal requirements that relate to those education programs, an audit, evaluation, or enforcement or compliance activity. As far as early childhood education programs, under U.S. Education Code 1003, the term early childhood education, and this is where you guys are really going to focus on that last bullet there, is state licensed or regulated child care programs. And again, Head Start programs fall under this early childhood education program. But for the PDG B-5 program that's funded by the U.S. Department of Health and Human Services, generally when we look for the applicability of FERPA, we say follow the funding stream. If your program is funded by the U.S. Department of Education, then FERPA applies. In your guys' case, early childhood developmental programs are generally considered under this definition to meet the definition of an early childhood education program. Thusly, FERPA would apply to the records that are maintained by your program. Again, that program serves children from birth through age 6 that addresses the children's cognitive, social, emotional, and physical development. And now I'm going to go ahead and turn it over to Ross Lemke, the current director of PTAC.
So FERPA, it sort of represents that 500-pound gorilla in the room as far as student privacy goes. It's sort of the granddaddy of education privacy laws. Now, passed after FERPA was enacted in 1974 was an IDA Part B and IDA Part C, the Individuals with Disabilities Education Act. Part B is for school-age children, ages 3, and as well as ages 3 to 5, through Part B 619. Part C is for your early childhood special education children. So there are confidentiality provisions in both statutes. Now, both of them look very, very similar to FERPA in many respects, but there are a few key differences. So if you are starting to link to early childhood data that's in Part B or Part C, it's important to look at both statutes just to see if there's any additional protection that you need to enact as a result of using that data. So to whom do these three statutes apply? So FERPA applies to some educational agencies or institutions. Any public or private agency or institution that provides educational services or instruction to students or is authorized to direct and control public elementary or secondary or post-secondary education or post-secondary educational institutions. And I think the most important bullet here is to which funds have been made available under any program administered by the Secretary. In this case, we're referring to the Secretary of Education. So FERPA is very much a follow the money statute. If you are receiving services from a program administered by the Department of Education, quite likely you are subject to FERPA. So an IDA Part B applies to a participating agency that collects, maintains, uses, or uses personally identifiable information or from which information is obtained under Part B. And Part C has a very similar definition to the definition under Part B, but of course references Part C. An important note to understand on IDA Part B and Part C is that the Office of Special Education Programs at the U.S. Department of Education has a different perspective on the appropriateness of certain exceptions under FERPA. Generally, the use of the studies exception is not seen as an appropriate exception for the use of IDA Part B, Section 619 or IDA Part C data. So generally, this is subscribed to that you should be using the audit or evaluation exception. So if you have some sort of project that wants to use the studies exception for these types of data elements, I highly recommend that you reach out to the Office of Special Education Programs to work with them to see if the studies exception would be appropriate or how to make that particular request work under the audit evaluation exception. So outside of education law, we have some other statutes. So Health Insurance Portability and Accountability Act of 1996, otherwise known as HIPAA. Pretty much everybody in this audience should be somewhat familiar with this because everybody here has probably gone to the doctor's office at least once. So this law was enacted to establish certain protections around health data, insurance data. It required standards for the exchange of electronic information, things like billing code or payment for health services. It set a process and a timeline for establishing privacy and security protections for personal health information used in those electronic transactions. So there are a few definitions like who has to comply. So whereas in FERPA you might have educational agencies, in HIPAA you have something called covered entities. Covered entities could be a health plan, like your health insurance. Healthcare providers, that could be your doctor or nurse. Healthcare clearinghouses, these are entities that convert non-standard information into standard format required for electronic transmission. Applicability of HIPAA privacy protections to these entities is not dependent of the recipient of federal funding. Business associates need to comply. So individuals or organizations performing a service on behalf of a covered entity or provide services to a covered entity, and services that involve the use and or disclosure of protected health information. Some examples of this could be an entity that helps the agency with claims processing and billing third-party reimbursements such as Medicaid or private insurance. A private legal firm that has access to protected health information and in the course of its work for the agency, or a technology company that has access to protected health information while working on fixes to a state data system. So under the HIPAA privacy rules, there are certain individual rights. There's a right to receive notice of privacy practices. You normally see this when you go into the doctor's office. Rights regarding access to records, who can access those records. There's a process in place for correcting and amending those records. There's accounting for disclosure, so there's recordation requirements under HIPAA, much as there are recordation requirements under FERPA. There are restrictions on information sharing, and there's a means of confidential communication. So HIPAA is more prescriptive in terms of data security and how institutions can converse with each other, the technology standards. FERPA relies on something called reasonable methods, which is much less prescriptive. And much like FERPA, that you have a right to file a complaint if your rights under HIPAA have been violated. So on September, before I actually go into the HHS new rules on Head Start, I would state that a lot of times there are some intersections between HIPAA and FERPA. So with my children, if I want them to go to school, I need to get them vaccinated. I go to the doctor's office and I go and they get their shots. The information that the doctor's office is maintaining on my children is protected by HIPAA. When I get a copy of those vaccination records and I walk them over to the school and hand them to the school, once the school takes them and maintains them, they become protected by something called FERPA. Basically, joint guidance years ago between HHS and the Department of Education said that if it is a medical record that is maintained by the U.S. Department, maintained by an educational agency, then FERPA protections are in place as opposed to HIPAA protections. There's a good resource document that's on PTAC's website that sort of answers a number of questions about the intersections of HIPAA and FERPA, and I would certainly encourage you to take a look at those. Moving on, so back in 2016, the Office of Head Start announced in the Federal Register a comprehensive revision of the Head Start program performance standards. This is the first one since their original release in 1975. So as part of these new performance standards, there was a section, subpart C, that addressed the protection for the privacy of child records. So this subpart outlines sort of certain requirements to protect personally identifiable information in child records. So you'll notice in the following bullets here some of these key components. Parental consent, including 9 instances where consent is not required. So written agreements with third parties to protect PII when disclosing data. Parent rights in respect to their child records, so a right to inspect, amend, request a hearing and a copy of record, and also right to inspect written agreements. There's elements there on maintenance of records, so the data destruction in a reasonable time frame, ensuring that only appropriate parties have access. And then data systems are protected to current industry standards. And then there's an annual notice to parents. For those of you that work in the K-12 or early childhood education world where FERPA is implicated, you'll notice that there are a whole lot of similarities between these new privacy protections under Head Start as FERPA. They're very similar in many, many respects. So in that same subpart C, it states that if a program is subject to FERPA, for example, a school district, then the program does not comply with this subpart. So, if it is a school district-run early childhood program, then FERPA is in play. If a child record is subject to the IDA confidentiality requirements that I talked about earlier, then the program follows those requirements for that child record and not this subpart. So there's an exemption to consent in the early childhood integrated data system context. So that subpart allows a program to disclose PII without consent to officials from a federal or a state entity to evaluate education or child development programs, provided that some control is in place, such as a written agreement. This standard allows a program to share PII with their state data system, without parental consent for the purpose of evaluating education and child development programs. This is analogous to the audit and evaluation exception under FERPA. And that hyperlink below links you to the language in the statute. It links you to the language in the regs. Finally, something that everybody should keep in mind is that FERPA and the rules under Head Start and IDA, these really represent the floor for protecting student and child privacy. It's not the ceiling. So in many cases, there are state and local laws on the books that might add some additional restrictions on how you collect, maintain, protect, and use data. So as you are beginning to go and build or continue to build these integrated data systems using early childhood data, you need to be cognizant and aware of the laws that are in place in your own state, perhaps even county, or if you have data from Indian tribes, tribal law might apply. So as part of any project, whether it's with an integrated data system or with a specific research project, you should begin those projects by reviewing all of the relevant privacy laws, both at the federal level, but at the state and local level. Because in many cases, as you've seen before, more than one law might apply to the data. So the next couple slides list some resources that we have available for you. The first links here are from the Privacy Technical Assistance Center that is operated out of the United States Department of Education Student Privacy and Policy Office. These are technical assistance resources. There are many that focus on early childhood. The integrated data systems and student privacy talk about joining multiple systems together, and the FERPA exceptions that sort of apply to the joining. There is a document on understanding the confidentiality requirements applicable to IDA early childhood programs. This was produced by by OSEP, talking about student directory information. Best practices around the authentication of somebody's identity when trying to get access to data. There's a crosswalk between the FERPA statute and the IDA statute. Some advice on data de-identification, discussing basic terms, and as well as a frequently asked questions around disclosure avoidance. There is a early childhood integrated data systems toolkit. Then also there's some resources outside of the Department of Education. Department of Education does funds some technical assistance centers around the use and protection and the collection of IDA data. Both the IDA Data Center, which is the first link, and the DAISY Center have done some work over the years around confidentiality in the IDA sense. And then the last two links link to some Head Start resources. The first of which is the new Head Start Performance Standards, 1303 Subpart C, focus on the protections for the privacy of child records. And then there is a Head Start FAQ represents that last resource there. So I am going to pause for a moment, and we have some time here for questions or stories from the field. If people have horror stories or lessons learned, or if they have questions about any of these statutes, we would be interested in hearing from you.
So Sean and Ross, we did have one question in the box and it was regarding ownership of ESID data. Is integrated data owners are owned by an early childhood advisory council, a cabinet agency, or a data governance committee, or other governance body? Do you have any
Yep, and this is Sean.
for that?
Yeah, absolutely. Thank you, Jim. So that's a very critical question that should really be addressed prior to developing out your integrated data system. Generally, what we would look towards is for a data governance program to determine whether or not the data is sufficiently de-identified and owned by a central early childhood group or a cabinet agency. However, a lot of the ways, or what we generally see across the field, is education data maintained in an early childhood data system is usually owned by that education body. Just like health data would be owned by the health body, and data from children and families or other programs would be owned by those individual programs. The reason we look at this is that when that data is going to be used, we look to those groups to really inform the use of that data to make sure that if we're using health data, well, the health organization should be the experts on the use of health data in compliance with relevant federal and state health laws. So we would want to look to those experts and kind of leverage some of those expertise from our partner organizations in order to really develop a robust data system. I hope that does clarify it. And additionally, that ECIDS toolkit really does a good job of addressing data governance. And I know that this is the third webinar in a series, and I believe the first webinar was all around data governance, and it was put on by a few folks from our team. Again, ownership of data is really critical because you want to make sure that you're using the data in an effective, informed, and a compliant manner.
Sean, this is Jim, and this raises another question that I have related to your answer and Mary's question. So when a state or local entity enters into a process where they are sharing data, most likely, I guess, de-identified, but I'm just going to use the term sharing data. Does each entity make the assumption that they have already complied with their own privacy rules? So the question is, because in early education, we may be sharing data both from education and from health and maybe family services. So as those agencies make their data available to that single source who's aggregating the data, is the assumption then that each of those agencies complies with their own privacy regulations? And have
Jim,
you had that issue?
Yeah, that's an excellent question. So generally when we think about de-identified data, we think about data that's reported in the aggregate or at the program level or the state level, where we're not really talking about individual student level records. In that case, again, the recommendation would be, depending on, again, local, state laws, things like that, if there's prescribed disclosure avoidance requirements, such as cell suppression, perturbation, or other disclosure avoidance methodologies that need to be applied, we would look to those participating organizations to inform that process. For example, if we had three state organizations who are contributing data to a central or even a hybrid federated data system, what we would do is we would look to those organizations and say, who has the strictest requirements for privacy? Sometimes, again, different state organizations might have small n sizes that they require that we redact numbers when they're reported below a certain threshold. And that additional privacy safeguards be put in place. So we would, again, recommend that that conversation happen prior to either developing the system or definitely prior to reporting out that data. It is, generally straightforward once you identify those business rules to, again, identify what's the most strict and apply those business rules when you are reporting that data. Jim also mentioned de-identified data. And again, de-identified data is generally when all personally identifiable information has been stripped from let's use a data report, for example. It would not be sufficient. It would not be a sufficient level of de-identification under the guise of FERPA just to remove the student name and the student ID number and then report all of that data in the aggregate. FERPA would require that extreme populations, for example, if there is only one child who falls into a specific category, or if all children fell into a specific category or showed a specific outcome, it would be disclosive to a reasonable member of the school community which children received which outcomes. So that's really why when we look at integrated data systems, including with ECIDS, generally FERPA is going to be the strictest. Now, I do say that with keeping in mind that HIPAA does have additional privacy considerations, and for everyone on the phone, if you ever reach out to PTAC, this question will generally be met with the response of, it depends. And it depends really has to do with us having a conversation to find out how is that data being used, where is it coming from, how is it being reported, where is it being reported, and things like that. I do see another question that just came in, so I'll go ahead and read that out loud for everyone. We have someone who is interested in knowing how to handle data release in the case of parents who are not together when the family data is involved. So generally under FERPA, FERPA does not have consideration for custodial parents. So just because the mom might have custody of the children does not mean the dad is not afforded rights under FERPA. We would look to either a court order that would strip one of the parents of their rights, and then that court order must, should be included in your program, or at least in the considerations before providing access to a parent. And again, looking at today's sort of environment and landscape, sometimes there might be protective court orders in place where, due to threat of harm or violence, one family member might, there might be a court order that restricts letting another family member know the whereabouts, the physical location of those other family members. So this is kind of a tricky conversation. Definitely it depends would be applicable here, but I would recommend whoever asked this question to check out the PTAC website, and we have a lot of guidance there for working with parents and what those policies and practices in an education program type environment should address, and what other considerations should be applied when you're getting a request. Ross mentioned that identity authentication best practices guidance, and I believe that touches on this very concept. So again, I would encourage you to peruse some of those resources that we've provided in today's webinar. And if you can't find those resources on our website, again, please go ahead and shoot us an email through the Contact Us button at studentprivacy.ed.gov. I believe we'll have a contact slide page at the end of today's webinar with all that information.
Thanks, Sean. I wanted to add in a couple extra points on what you just addressed. As far as the de-identified data goes, Sean talked about data in sort of a more aggregate sense. Something we do here in the field a lot is this sort of concept of de-identification. And it's just something to sort of be aware of as you're starting, if you're sharing child level data, depending on where it's getting sent and the appropriate written agreements in place. That de-identification oftentimes isn't just taking off that name column. Sometimes de-identification is more involved because if you have populations with smaller unique characteristics, it might be you might be able to go back and reverse identify somebody. Also, to go back to Kim's question about the case of parents who are not together anymore, just one sort of lesson learned from the field is that FERPA, both FERPA and the Head Start regs have a 45-day access requirement. So while yes, under FERPA, both custodial parents have both custodial and non-custodial parents have access, if there is something off about the request, say that the child in question has only been associated with that one parent, and now this other parent has come completely out of nowhere, and all that they're requesting access to is not how the child is doing in their relevant program, but the emergency contact list for that child. That might raise enough red flags that you might want to take advantage of that 45-day window to get really to the bottom of what is going on with this specific family. I'm going to pause for a second and hand the mic over to Steve, who wanted to share one more important lesson learned in the last 5 minutes that we have here.
Yes, thank you. Can you hear me okay?
Yeah.
Perfect.
Can you hear me?
Yes.
Oh, good. As I was listening to Sean and Ross, I thought of one of the most important lessons I've learned since I've been working on this 3 or 4 years. When I came here, we thought we're going to adhere to FERPA, and that's one of the highest rules, regs with regards to protecting data and privacy. And then so we designed our system and our data sharing agreement and our data governance manual with very FERPA centralized. However, the drawback to that, or something to keep in mind, here's the lesson well learned. You cannot utilize the FERPA audit and program evaluation exception for data and programs that aren't covered by FERPA. So we were going to use the FERPA audit evaluation exception, but you can't use that for WIC or home visiting or Help Me Grow, programs that don't fall under the FERPA umbrella. So what we've done in those situations, being uniquely situated here at the Department of Health, is to make sure that we're getting the proper parental consent in the intake procedure. With a program like WIC, we worked with their feds, we looked at their code, and we worked with the local program leaders to make sure we were all lined up and that we had parental consent in place. Very similar thing that we did for home visiting. And with regards to HIPAA, since our matcher database at this point in time is not HIPAA certified, HIPAA approved, if it's HIPAA data, or if a parent might be in a situation where they think it's HIPAA data, such as doing an ASQ in a doctor's office, well, then we have the parent release those HIPAA protections. So that's how we were able to do our eKids here at the Department of Health, is when we could utilize FERPA in a FERPA exception, such as or Head Start, like, as you mentioned, very similar, then that's what we did. But you have to look at every individual data source and see what governs that data. And the mistake that we had in place is that we thought we'd be able to perhaps utilize that audit and evaluation exception for all of our early childhood programs, and that's just not applicable.
Steve, that's a great point. And one additional piece I might like to add, again, with parental consent, you don't have to worry about any of those exceptions because you have the consent. And again, having parental consent, include that step during the registration process for your program. Have the parents sign off and be transparent. Let the parents know that you do evaluate the effectiveness of this program, and that's what that student data will be used for. The only identifiable data being used to match student data across different agencies and things like that. So again, having those considerations during the development phase of your data systems is very critical. Those conversations are critical to have at a very early step, so you know what you need to have in place and how you can actually perform those matches.
Okay, great. I don't see any other questions in the chat box. Thank you, Ross. Thank you, Sean. Thank you, Steve, very much for the webinar today. Great information, a lot of information. We would love to hear back some feedback and suggestions if you have any. There's a survey. You can directly link to that survey from this slide if you'd like to give us some feedback today. We will also be sharing the recording of the webinar along with the slide deck following this event, and we'll have a link to the SurveyMonkey there as well. Without any further ado, I see we're at 4 o'clock. Thank you all for joining this Communities of Conversation today. Thank you again to Ross and Sean for bringing this information, putting it together into the slide deck and sharing it. And thank you to the Utah team as well. I also want to give a shout out to the PDG B-5 team who behind the scenes have been hosting and managing this, and a special shout out to Evelyn Keating today. Thank you all very much, and have a great rest of the week.